The following program was paid for by Atlantic Neurosurgical Specialists. The views and opinions expressed on Answers Live are not necessarily those of the staff and management of the station. Management has not investigated the claims made during this program. The views and medical recommendations of guests on Answers Live are not necessarily those of Atlantic Neurosurgical Specialists. As always, consult your health professional regarding any medical decisions.
Welcome to Answers Live, your community medical connection, making a partnership of good health. The studio lines are open for your calls and questions. Call 973-267-9687. Now, here's your host, Tom Wood.
Good morning and welcome to Answers Live, your community medical connection, creating a partnership of good health. My name is Tom Wood, and I am the host of Answers Live, brought to you by Atlantic Neurosurgical Specialists. As you know, we are the largest subspecialized neurosurgical group in the state of New Jersey, with our main office located right here in Morristown at 310 Madison Avenue. Our main number is 973-285-7800. Our website is ansdocs.com. Again, that's ansdocs.com. There's a lot of new changes going on here at ANS, so visit our website. Look at the new study trials that we're running in our brain tumor center as well as our vascular center, and all the new educational material we have for you. And also always visit the website for the show, which is answerslivnj.com. Again, that's answerslivnj.com. Okay, as you know, I always bring in specialists, bringing you the top in New Jersey. I'm bringing back one of our guests that was here probably about a year ago. His name is Dr. Tom Thomas, and we spoke about HPV, and we ran a screening on that. Exciting news on that topic is that we're going to go over all that information again, but now there actually is an HPV center at Morristown Medical Center right here in Morristown, and we're going to talk about that. So I just want to say again, welcome Dr. Tom Thomas.
Thank you, Tom. It's great to be back. We have a lot of good news coming up your way.
Awesome. Dr. Thomas, for those who haven't heard our show, and hopefully there's not very many people out there, we have a pretty good following. Just a little bit about who you are, a little bit about your background, and what you do at Morristown Medical Center.
I recently joined Morristown Medical Center, Head and Neck Cancer Center, as the Director of Head and Neck Reconstructive Surgery and Transoral Robotic Surgery. I am here from Boston. I was practicing head and neck surgery there at Dana-Farber Cancer Institute and Brigham and Women's Hospital. One of the reasons I'm here is I grew up in Rockland County, New York. It's about 40 miles north of here, so I am closer to home, and I had a wonderful opportunity to expand the head and neck cancer program here, so that's why I'm here.
Well, welcome, welcome very much again to the show. This is such an important topic, especially from last time when you were here. I learned a lot about HPV, how it correlates to men and women, especially in men with according to throat cancer, and we'll touch base a little bit about that. It's also a great time to bring you on the show because it is Oral Head and Neck Cancer Awareness Month, which is a very important. We use these months for people who are wondering, like Stroke Month, Brain Tumor Month. These months are dedicated to really educate people and bring awareness to a specific cause or a specific disease. Head and neck is something that, as you know, is very, very serious. When you do, unfortunately, are afflicted with this, you have to find the best in the area for treatments, surgically, radiation, oncology, and you can get that all through the Morristown and Atlantic Health system. So that's why Dr. Thomas is here. We're going to kind of start talking a little bit about, again, what is the human papilloma virus, or HPV. So let's just start there basically. What is it?
Human papilloma virus is a DNA virus that is a family of probably 120 to 200 different types of viruses. Many of the viruses cause warts and like. Some of them causes tumors, and approximately 4 of them causes cancers that we found in the throat. HPV 16, 18, 30, and 31. Over 90% of the HPV-related oropharyngeal cancer is caused by HPV 16.
Okay. So out of the 120, I guess that's how you do is you name these viruses per se?
Exactly.
Okay. Now, of course, every time I bring someone on, I start thinking to myself, oh my God, how do you get these viruses? Is it like getting any other virus? I can drink someone's water. How do you get an HPV virus? And who's at risk for getting it?
HPV is the most commonly sexually transmitted disease in the world. So the technical answer is it is through mucosal contact or close contact is how you transmit HPV. Most of us will somehow get one strain or other of HPV once you become sexually active. Most of these viruses are cleared from our system by our immune system. Some of the other viruses has the capacity to stay dormant or hide for decades, and it can manifest in different forms as warts, tumors, or cancer later.
Okay. So someone is, now you say mucosal, that's oral, so can you get it from kissing?
Technically, yes.
Okay.
But the studies have shown that unprotected oral sex is highly implicated in getting infected with HPV.
Okay. You also said decades, which means my listeners know how old I am, 50-ish. So you're talking I could have contracted, oh, God forbid I didn't, in my 20s, in
yes.
college, in high school. It could lay dormant that long.
That long. And we don't know what triggers for the virus to reactivate.
Okay.
So that's what happens.
Okay. Now, my children, I know they're now 22 and going to be 18. We were approached years ago to get these shots to prevent some of these cancers through HPV. Is that this type of the 4 that we're talking about?
Yes, they have several different vaccines available for HPV, preventing HPV. It is recommended that children get this vaccination before they become sexually active. For example, Australia is committed to providing all of their citizens with this vaccine, and the compliance rate in that country is close to 80%, and they are adamant about having no new HPV-related cancers, let it be head and neck or cervical, in the next 20 years. So screening, early detection, and vaccination works to prevent this.
You do hear a lot about women having cervical cancer, probably more than we're comfortable with hearing. Is all cervical cancer HPV related?
Almost all of the cervical cancer is HPV related.
Wow. Okay. And with men, that's kind of a new thing we hear about with throat cancer. First of all, is that always HPV related? I'm assuming probably not, because you have the smoking and all the chemicals and that kind of thing. Out of the ones that are, how much are HPV? And how do we know that it's HPV?
So head and neck cancer used to be mainly driven by people who smoke and had excess amount of alcohol. For the last 10 to 15 years, it has changed, and more cancers of the throat are caused by HPV. So we have approximately 51,540 cases of oral and oropharyngeal head and neck cancer.
Wow.
And they're estimating that at this point, especially the oropharyngeal cancer, up to 75% or more is caused by HPV, less from tobacco, because the overall use of tobacco has gone down in that population.
Okay. So if you contract this when you're younger, I guess what I'm working up to is now you're married for 25 years or 15 years, and you find out you have this HPV-A, I can see it causing some issues with a relationship, because people would think, oh my God, you're doing something. Do you find that in your practice?
Oh, absolutely. I have had dramatic moments in my clinic.
Okay.
But what I try to reassure the couple is that this could have happened decades ago. It doesn't happen last year or 5 years. So it could have had, been in your system a long time before.
Okay. So let's say you're, being a good person and you're not sexually, active or whatever. You can't catch it, say, today and it shows up next year or next week. It's something that
we have not seen that.
Okay.
Yeah, it takes a while, and we don't know what triggers the virus to trigger the cancer formation.
Okay. And do some people have it and never have an issue ever?
That's why I say majority of us will have HPV infection. Over 90% of those are cleared by our body without we even knowing.
But even happens. These dangerous 4? Or what?
Even the dangerous 4, there's, only 1% of those people keep it, and then it triggers the cancer formation.
Okay. Any correlation to it triggering? I guess, I always ask for myself and my listeners, is it people who smoke or have poor health or are obese, or is there any correlation for the people that you see? I don't know if there's studies that, people who don't take care of themselves tend to seem to trigger this virus or use chemicals or,
So let's go back. The head and neck cancer used to be caused by people who use excess alcohol and tobacco. People tend to be in their 60s or late 60s. And yes, some people did not take care of themselves. But the HPV-related cancer is happening more and more in younger, educated, especially white males, is what the study's showing. Okay. So it is not people who are not taking care of their health.
Okay. And what category is younger?
In the 40s.
40s.
Yeah.
So 40s, 50s.
Yeah, absolutely.
That age group.
So there's a couple of decades of shift to the younger side from before.
Okay. As far as symptoms of HPV head and neck cancer, does it present any different than any other head and neck cancer?
No, there are a lot of overlaps in terms of symptoms.
Okay.
Most of the time, men develop this lump on their neck that is not very painful, but it doesn't go away, and it slowly enlarges. They usually go to their primary care physician, get some antibiotic, but the antibiotic doesn't take care of the issue, and then they decided to come and see me with the lump on their neck.
Okay.
Sometimes you have sore throat that doesn't go away after 3 to 4 weeks, difficulty with swallowing, pain with swallowing, weight loss, or voice changes. These are all symptoms of head and neck cancer.
Okay. Some of them, as you're discussing them, I could say, okay, I'm screening myself as you're talking, that's how I get. Except for a lump, is it a lump that you can palpate and visualize yourself while you're shaving? Is it a lump in your throat? Is it something that you could find like a breast? You do a breast exam. Your testicles, you do a testicle exam. Is it something where you're just sitting here rubbing your neck and going, that's kind of weird?
Surprisingly, a lot of the neck lumps are felt by the patient.
Okay.
Or when they go to their primary care physician for their annual checkup, the physician feels it.
Kind of like a lymph node enlargement?
It's a lymph node enlargement, yes.
Okay. All right. I'm going to take a quick break because this is a lot of information, so I want to absorb it and then come back from break and really delve into a little bit more of this. I'll be right back with Dr. Tom Thomas.
There's a unique place in New Jersey, a pioneer in healthcare leading the way with their nationally recognized spine center and their extraordinary support groups dedicated to providing emotional and logistical assistance. That place is Atlantic Neurosurgical Specialists, ANS, well known for improving lives with exceptional neurosurgical services, medical first, and one-of-a-kind programs. ANS, home to New Jersey's largest group of world-renowned fellowship-trained neurosurgeons offering advanced treatment options like stereotactic radiosurgery, a non-invasive and highly effective treatment for an increasing number of brain and spinal tumors. ANS, a leader in stroke care with a success rate greater than the national average, among the first in the country to use stent retrievers, allowing surgeons to immediately restore blood flow to the brain. ANS, using advanced computer-guided technologies for minimally invasive spine surgeries that reduce recovery time from weeks to days. ANS, restoring hope and helping patients regain their lifestyle. ANS, making next-generation treatments possible today. Don't let insurance come before your health. ANS accepts all patients. For more information, call 973-285-7800 or visit ansdocs.com. ansdocs.com.
Welcome back to Answers Live. I'm your host, Tom Wood from Atlantic Neurosurgical Specialists. I'm here again with Dr. Tom Thomas, and we're discussing HPV-related head and neck cancer and also the new HPV Center at Morristown Medical Center. Before I get back to Dr. Thomas, I'm going to give you some numbers, so get your pen and paper ready. To contact, they're going to have a big screening that Dr. Thomas is going to talk about coming up. So to register for that screening, it's 1-800-247-9580, or you can email headandneckcancer@atlantichealth.org. To make an appointment to see Dr. Thomas at the HPV Center, it's 973-971-7355. And again, I'll repeat those at the end of the show, and you can always call the station, and they'll give you that information. Dr. Thomas, we really touched about HPV, the causes, what to look for, but I don't want to, let's say, redo the old show. People can go on the website and listen to our older show, but what's going on that's new?
Absolutely. One thing that I wanted to talk about is the multidisciplinary team that we have at Morristown Medical Center now. I have a partner, Dr. Cohen, who is a head and neck cancer surgeon, and James Wong is our chairman of radiation oncology, who has a focus on head and neck cancer. And we have a new medical oncologist, Dr. Misak Haigans, who recently joined us. He has an interest in head and neck cancer. He's a medical oncologist. He is opening up several clinical trials for our patients. So we have a complete or a comprehensive group of people dedicated to taking care of head and neck cancer, which is probably the biggest number of physicians just treating one in the state of New Jersey.
Right, yeah, that is big.
So the second thing you already mentioned is we inaugurated our Atlantic HPV Center on April 4th, 2018. This is the first of its kind, probably in the nation or in the world, in terms of having a dedicated center, HPV Center, focusing on head and neck cancers. And eventually we hope to have cervical cancer treatment experts there also.
Okay.
And the third thing, again, you mentioned is my job not only to see patients, also to improve the health of my community and educate them about what is head and neck cancer. That's why we celebrate April as the Head and Neck Cancer Awareness Month, in order to catch any tumors or cancers early. We are doing 3 different screenings. One already passed. We have April 19th and 23rd coming up. I urge any of your listeners to come and see me if they think they are at high risk. Not to just come and see me, but if they think they use excess amount of tobacco or alcohol in the past, if they have any active symptoms that we talked about before, or if they had a history of STDs or HPV infection, or their partner had an HPV infection. Those are high-risk patients to come and see me.
Okay. Question, how would someone know if they had an HPV infection in the past?
So ladies, when they get their pap smear, they have that information.
Okay.
So that's what if the partner has it.
Men
usually don't. Male, they wouldn't know.
We don't. We just walk around and we don't know. If I was sitting here right now and you were going to do a screening on me, what would you do?
So screening is essentially listening to you and getting history from you, which I'm able to assess your risk from talking to you about your past exposures and what have you done in the past. Then the second part of that screening is physical examination of your head and neck.
Okay.
So I will examine your head and neck area, skin, ears, eyes, nose, oral cavity, back of the throat, and the neck.
Okay. All right. I guess I'm going to have to go for a screening, but I'm getting mine next time, which is very, very important. With the HPV Center, you're saying it's new, it's different. What's different from that center than your head and neck center? Are you going to do testing for HPV there? Because, my thing is people don't hear this are going to come flooding to your office for these tests to see if they even have HPV. How does that work? So
HPV Center, we assembled a group of experts in head and neck cancer under one umbrella. So there are several phases to the center. First is to give educational material for people who are looking. Second is to see how we can prevent it. So we will have information regarding vaccination. Then, if they have any early symptoms or people are concerned about it, to come and see me for official visit outside of the screening. Then, if someone or their loved one has been diagnosed with an HPV-related cancer, they can come and see us for first opinion or second opinion to see how we will manage their cancer. So it's a comprehensive way of looking at the cancer.
Okay. Question for you with HPV, say head and neck. My wife's mother passed away. I'm married how long now? 24 years? So 23 years ago. But the reason I'm bringing it up, she had a lump on her throat, was misdiagnosed, and I just remember it was squamous cell. When you have an HPV cancer, how do you know that that's an HPV-related tumor? Is it you biopsy it and it shows a virus, not a squamous cell, or how does that work?
So tobacco-related cancers and HPV-related cancers are all squamous cell.
Oh, okay.
But the pathologists have different stains to look at it and identify and separate where this comes from. And there are ways to look at HPV-related genetic material in that biopsy specimen to identify it as HPV or not.
Okay. She was definitely a heavy smoker. So when you see it's an HPV-related cancer opposed to a smoking cell, the virus and the tobacco kind of cause these cells to mutate and start the cancer cascade. Is that what happens? I think with most cancers, right, something triggers it.
Right. So if you look at the tobacco and alcohol-related cancer, these are carcinogens over decades worth of exposure. Your normal cell and DNA mutates and changes, and they will undergo uncontrolled growth, which is what cancer is. HPV is a similar way that the virus has the capacity to disable our guards, if you want to think about it that way. The guards who make sure nothing goes awry, they disable them, so the cells grow uncontrolled. But we know that HPV-related cancers tend to have less mutations in their DNA than the tobacco-related. That's why HPV-related cancer has a better prognosis and patients do well compared to the tobacco-related cancers. However, if somebody has tobacco and HPV, it's not an advantage. I mean, it actually hurts compared to somebody who just have head and neck cancer from HPV alone.
Okay. If you have the HPV, tumor, I know your skill level because we were talking before the show. You work with a few of our neurosurgeons and doing miraculous work together, and I hear how skilled you are. When you have this, what is the cure rate of it? Of course, they have to go to a good surgeon, but what is the cure rate? Because my biggest fear is head and neck cancer, and I told your wife from years ago training. But what is the cure rate on these?
Right. So it used to be abysmal in terms of treatment. You used to have surgery that split open people's face and neck, and they stayed in the hospital for 4 weeks or more to recover. And even with the best recovery and best surgery, people still had problems with eating, swallowing, tasting, breathing, etc. So it was a difficult surgery to go through and recover. Nowadays, we are using transoral approaches, let it be laser or the robot, to remove these cancers through the mouth. So instead of staying in the hospital for 4 weeks, they are staying 4 days. And you can get rid of the cancer in 40 minutes instead of 4 hours or more of surgery.
Wow.
So
Less
damage, less surgery, less functional deficit, better life after. So overall, the cure rate has gone up from maybe in the 40s to, depending on what stage of the cancer, could be 80, even 90%.
Okay.
So cancer survival all depends on the stage of the cancer.
Right. And if you palpate a lump, how soon is that into the process where you can actually feel a lump? Just being in clinical for so long, usually when you get to a size where you can see it on a chest X-ray for lung cancer or something, it's been there a long, long time. Do these cancers tend to grow quickly where you may palpate a lesion or come to you and say, look, I don't know, I see this thing in my mouth, and it's relatively been there a short period of time, or is that lump mean it's been there for years?
Squamous cell carcinoma in general are slow-growing tumors.
Okay.
I'm sure when somebody comes to me, it's been there for months.
Okay.
Before they detect it and come to see me. The interesting thing about HPV is that the primary tumor where you usually find them is in your tonsils, which are the tissue on both sides of your throat, or the tonsil tissue on the back of the tongue called base of tongue. So the primary tumor where it starts is usually small, but the lump that shows up on the neck is very big. Compared to if you were smoking and getting the cancer, the primary site tend to be bigger and the lump used to be small. So in 2018, American Joint Committee on Cancer changed the way we stage HPV-related head and neck cancer. Even though the lump is big, they are still early stage because patients tend to do well.
Okay. So before we end the show, our time always flies so quick. I always want to get closing thoughts from you. Before I get your closing thoughts, let me give these numbers out because that's the most important, really, is for people to get a hold of you and get to the screening. The screening for you, if you want to come screening, is 1-800-247-9580. And again, these fill up really quick. So just, call up, get on that list. If it becomes where they can't accommodate you, I guess we discussed maybe having additional screenings in the future, but just get your name there so they have your information and your email, so the center could reach out to you at another time. Again, that was 1-800-247-9580, or you can send an email to headandneckcancer@atlantichealth.org. To see Dr. Thomas and one of his team, it's 973-971-7355. Dr. Thomas, like I said, all my shows, a few ending words about HPV, head and neck cancer for our listeners.
So head and neck cancers will give you signals something is not right. So if you have a lump, sore throat, difficulty, or pain with swallowing for over 3 to 4 weeks, definitely see a primary care physician. If you detect the cancer early, it is easy to diagnose, and we can deploy minimally invasive way to treat it. And less surgery, less treatment, the better function the patient keeps, and a better prognosis afterwards.
Okay. Incredible information, everyone. Like I said, I know it's a lot to listen to on the 30-minute show. If you need to have more information on that, or you want to hear this show again, visit our website at AnswersLiveNJ.com. Again, that's AnswersLiveNJ.com. Again, I'm Tom Wood from Atlantic Neurosurgical Specialists. Our number is 973-285-7800. Thanks, and have a wonderful Sunday.
Join us again next week for Answers Live, your community medical connection, making a partnership of good health.
The preceding program was paid for by Atlantic Neurosurgical Specialists. The views and opinions expressed on Answers Live are not necessarily those of the staff and management of the station. Management has not investigated the claims made during this program. The views and medical recommendations of guests on Answers Live are not necessarily those of Atlantic Neurosurgical Specialists. As always, consult your health professional regarding any medical decisions.